My name's Kimberly. I'm going to be your nurse today. We're going to be doing a postpartum assessment on you, if that's okay. Alrighty. Can I get your name and your date of birth? Okay. Alright, do you have any allergies we should know of? No? Great. Alright, I'll be following my general principle and safety practices. And prior to this, we have assessed the patient's H&H, their rubella titer, and their RH factor if they was to need RhoGAM. We have already assessed the patient's vital signs. Everything is within normal limits. We have already had our patient get up and use the restroom at this time before we get started. And we have measured her urine output. All right, and I've done my hand hygiene. So I'm gonna put my gloves on. Okay, and throughout this assessment, we will be assessing pain throughout the whole thing. Alrighty. So I am going to be doing a breast exam if that is okay with you. Yes, so we have obtained consent to get started. Okay, so I would assess if my patient is breastfeeding or non-lactating. If they are breastfeeding, I would check the condition of their nipples to see if they are cracked, bleeding, any abnormalities with that. We are going to be assessing for engorgement. And everything looks good. If she is not breastfeeding, we want to avoid stimulation. And we would tell mom to wear a supportive bra, whether she is breastfeeding or not. And she could use ice packs if she is not breastfeeding to help with discomfort. But everything does look good. So we are just gonna cover you back up. Okay, so I'm just gonna expose your area real quick. We're gonna be, and for the fundal exam, I'm gonna go ahead and lay my patient's head back, maybe, because we do want her in supine position for this. Great. Okay, so before I get started, I will listen for bowel sounds before I palpate. Okay, and everything looks or sounds great with that. So, have you been able to pass gas or have a bowel movement? You have? Great. Alrighty, and then we are also checking for bladder distension at this time, which she has already got up and went to the restroom. And we measured her urine output, it was good. And also when she goes to the restroom, we are having her change her pad. We're checking for the amount, color, and odor of the lochia. We are having her cleanse with a peri bottle with warm water in it, front to back, and applying a new pad front to back. And we're having her pat dry. All right, so I'm gonna go ahead and do her bundle exam. I'm gonna put my hand on the symphysis pubis, there we go. And then I'm gonna put my hand at the top of the uterus. And we are checking for the height, position, and the tone of it. If the uterus is boggy, we would massage it. We do want it firm. We want it midline, and it is in good height. It's right by the belly button. So that is good, everything feels good. Do you have any pain at this time? No, great. Okay, and when we are doing this, we are also assessing if the patient has any gushing, which she does not. We're also checking for any discoloration, edema, or anything like that, bruising, and everything does look good. Okay. Also, when our patient is going to the restroom, we are having her tell us about how many pads she is using, the saturation of it, to assess for hemorrhage. If she's using a pad more than, changing it every 15 to 30 minutes, it is a sign of hemorrhage. So we will monitor that and make sure she's not using any more than one pad in 2 hours. Okay, so I am gonna have my patient roll away from me. And right now we are assessing for any pulling under the patient. We are assessing for hemorrhoids. If she's had an episiotomy, we will be assessing for that. Which everything does look good. going to have to lay back. And I'm going to cover her back up. We're going to raise her up just a little bit. Okay. So I'm just going to take my gloves off since we have been at her bottom area. And now I'm going to be assessing her extremities. We're going to be checking for Hoffman's sign, or Holman sign, I'm sorry, which is have my patient dorsiflex. We're going to be assessing for any pain in the calf, any edema, swelling, bruising, anything like that, discoloration, which everything looks good. Any signs and symptoms of a DVT, which everything does look good. So we're going to cover her back up. Now that our patient is in a comfortable position, I'm going to be assessing her emotional status and to see if she is bonding with the baby, which she is. I will be assessing for any postpartum depression, make sure she has all of her needs and referrals before she leaves. We can help her with that. Make sure she does have a car seat. If she is not breastfeeding, we can send her home with some formula. Make sure she has good home support. And any community resources that she may need. But everything does look good. I would report to court, come back and evaluate, do my hand hygiene, and that is it. Thank you.